So now we're going to approach another topic that is interesting. We're concerned about security, but we're also concerned about our health. What can and must be done with the data collected to improve our health?
Ou seja, a partir de agora também.
So from now on, we are going to look at data. We've seen through the pandemic that we can learn to vaccine in order to prevent diseases and how. And so that is how are the companies using the data in order to improve our health? And this is what the question we are going to ask to Filipa Mosni Costa, Managing Director at the ENG Pharmaceutical Companies of Johnson & Johnson. Good morning, and good morning to everybody. And so it's an absolute pleasure being here. And I would like to congratulate the organisation, APDC, for the excellent programme. Well, I'm going to talk about health, and I think that we all agree with one thing. With no health, there's no economy. So if we all agreed with the impact on health and economy, that is very great. Over the last 2 years, we have shown the scale of this impact on the economy. And as we're talking about economy, I'd like to share with you a number of figures. I'm trying to share the numbers. Got them. So, as I was saying, there's no economy without health. In the next 10 minutes, I'm going to show you how, through information, we can make a quantum leap in health with an absolute, which is very important for the productivity of our society, so therefore the impact of health on the economy. And this is a study published by McKinsey, shows us the figures, impact figures on the European GDP. So better healthcare can contribute to another 2.4 trillion euros in a decade in the European GDP. It's an absolutely brutal impact. And that is why the European Union is aware of the contribution of health on the economy and is working towards this. The data, though, there are loads of data available, and so from talking to an information technology audience, the data available on the global level in the year 2021 was 79 zettabytes. And some of you no doubt understand better than me the dimension of these zettabytes. And the perspective is that until 2025, this number will double. And so everything is exponential. And this exponentiality that we will have in this data, in the number of data. Now, a third of the data available globally are data on health. 35% of the data available are data on health. And this shows the importance that we, society, give to health, with a tendency to grow. That is why the European Union is aware of the data on health and is working towards this, as I have said before. And it is preparing a European health data area. And these are the first steps taken on the 3rd of May. But about a little bit more than a week ago, it published, which is the preparation for the proposal for the legal framework for these European health data area. This is going to be a single area where our health data are available to be used for our well-being. So, as I said, it is important that Portugal starts working on this now. We're talking about electronic records, we're talking about genomic data, and this is going to bring about better health data. And so the better sharing of data, will it be better to make better decisions? And I'm talking about better clinical decisions, but also better decisions of those who decide and make policy and organizes health systems. And all of this each one of us will be the final beneficiaries. But research will be able to exponentially improve things and have the best solutions for our health. To give us an idea of how much we can save, because we're also talking about saving, and that is to treat better will bring about savings in the system. That is in terms of better health care and healthier and more productive society, but an acceleration in investigation and research, 11,000 million euros. So 11 billion euros, we think, in the decade, there will be better health care. But for this, we have to invest in infrastructures, and the key word, interoperability, cross-border interoperability in the European Union for all of this to be possible. And I'm going to show you some examples because there's an awful lot of literature on this topic. It's a topic which is central to our lives, but I'm going to give you some examples of where health data can allow us to have better health and more benefits. So obviously I'm talking about the prevention of chronic and severe diseases with better knowledge on the genome. With a database where we can get knowledge and information, will it be possible to interact or intercept diseases before they become serious? So the whole load in the treatment of serious diseases or the treatment of chronic diseases, all of this can be less of a burden for the whole of society. I've already spoke a few times about how research can help us move faster into artificial intelligence, and this happens with nowadays artificial intelligence through knowledge, acquired knowledge, and to sweep databases with information already published has also allowed us to speed up scientific research. COVID vaccine is one of the examples where artificial intelligence was used, but it is an increasing reality. The personalization of medicine, which has been heard about, those who are in the milieu know about it. It will be accelerated through the use of these databases. We talk about specific treatments for genomes. And says the future is now. It's been said quite a few times. CAR-T cells, that is the re-engineering of cells, our own cells that fight the disease. There are some in Portugal and there'll be more soon. This is the future to happen today. And this is science in action. And that is why if countries make this transformation, they will have no doubt have better results, and a more sustainable health system is something that we all want. And some more sustainable health systems and a greater economy. And that is why I'm sharing this data with you, and showing that Portugal, by using this accelerated path, an improvement of health, can have quite a saving. And this is what we want for our country. And so that is why I'd like to conclude as I started. There is no economy without health. I say that this digital highway is opening towards health. Another word of hope. We're all optimistic on this stage, but those who question whether Portugal can accelerate the system and catch the train, and this shows is an example that is made by Portuguese for all Portuguese. Imagine that the infrastructure that we have today, that is the finance system, that is everybody being the owner of the data. Imagine this can exist in the health sector with all the specificities that the health sector has, yes, it's possible. Imagine the savings that we have in this country, and of course, this will be a healthier finance system, which we all need. Thank you very much. With hope, future, and this is what we're going to continue to discuss in this Congress. But for lunch, we're going to talk about metaverses, 5G. So now's the time for lunch.